Well, good afternoon, everyone. I'm George Rudolph, President and CEO of PSECU. We welcome you to our headquarters facility. For those of you who are not yet familiar with PSECU, I'd like to share a little bit about who we are. PSECU was founded more than 85 years ago when 22 Commonwealth employees gathered just $90 and made an extraordinary commitment to each other to create a financial institution where pooled resources benefit all members. From those beginnings, and all while maintaining our founder's steadfast commitment to help members and their families achieve a better life, we've expanded our eligibility over the years. Today, we're Pennsylvania's largest credit union, proudly serving more than 450,000 members and managing more than $6 billion in assets. Because we're a not-for-profit financial cooperative, everything we do is for the betterment of our member owners and the communities we serve. Their well-being is our well-being and vice versa. True to our philosophy, our leadership has always believed that if we treat our employees well, they will in turn be prepared and able to treat our valued members with the high-quality service and care they deserve. Our Harrisburg headquarters building, where we are now, was constructed with that employee care concept in mind. Among other amenities, it includes this on-site child care center, which is run in collaboration with Bright Horizons. As a result of this, our employees and members of the local community have access to high-quality child care for children ranging from 6 weeks through kindergarten. Parents who use this resource appreciate it because it means they can conveniently leave their children in qualified caring hands as they start their workday. For our employees and our community, PSECU's on-site child care center makes life just a little easier and a little less stressful. I'm proud to say that throughout this pandemic, we've worked closely with our Bright Horizons partner to safely maintain the child care center open, not only for our existing users, but also for certain other essential workers in the Commonwealth. By keeping the doors open, we've been able to provide a valuable service to our local heroes that has allowed them to continue working, keeping all of us safe, making sure our grocery store shelves are well stocked, and caring for those in need of medical attention, for example. For PSECU, this child care center represents one of the many ways that we're able to support and strengthen the well-being of our members and the local community. Again, welcome to PSECU, and thank you for joining us here today. It's my pleasure to introduce Pennsylvania Governor Tom Wolf. And before I do, Governor Wolf, I'd like to just take a moment to personally thank you for everything that you and your staff have done over the past several months to keep all Pennsylvanians safe. We certainly do appreciate it.
Thank you very much. So thank you, George, for that nice introduction. Thank you for the thanks. It's something that I think is really important for all of us in Pennsylvania to try to stay safe through this. But I'm here, I want to say thank you to the staff at Bright Horizons. This is really incredibly important, what they do here. Obviously, PSECU is important, but I want to focus on the child care. This is something that is absolutely essential, and during this pandemic has really been tough. This has been a hard time for everybody, but I think especially for child care providers. And so what I want to do today is to say thank you and talk a little bit about why what you do here is so important and why Pennsylvania needs to continue to do what I hope we're doing, and that is step up to support what you're doing here. Again, you haven't had it easy. Back in March, a lot of child care facilities all across the Commonwealth, actually all across the country, probably around the world, closed. And many of them closed. And those that remained open lost many of their clients because parents were no longer going to work. I think here at Bright Horizons, you were down to a low of maybe, 17 kids with a capacity of 94. So this was the same thing that happened all across the state. And when parents were home because they were off work, some of them were still, who might have sent their kids to child care, were afraid for their safety and for their health. So this has caused a crisis for a lot of child care centers, which has meant it's a crisis for all of Pennsylvania. It's part of the pandemic crisis that we all face. With more parents now we need them to get back to work. One of the things that we have to do is relieve them of the pressure and the stress of not knowing what they're going to do with their children. It's really important that childhood education gets back as quickly as possible. But just to give you some sense of where we are, as of June 24th, 65 early childhood centers have closed. And I think I'm going to talk about, we have in June, the state used CARES Act money to the extent of $51 million. There were 100 child care centers that said, we're not going to be reopening, so we can't use it. We can't use the money. But 65, we know, have closed permanently. Of those 100, I don't know how many are going to get back eventually. But even before the pandemic began, affordable early childhood education was really, really important. It's important to our economy. The fewer child slots we have, the worse it is for people who are trying to get back to work. So that's why, again, in June, the state provided $51 million through CARES Act funding. In July, we're going to release another $53 million of child care development funds. And then there's an Act 24 from Pennsylvania, also using federal dollars, that after this we'll be using or investing another $116 million in early childhood centers. And that's just through the summer months. This funding is really going to help child care providers bridge the gap until their clientele returns, whenever that is. And it's also going to help them with any increased costs that have been incurred during the pandemic. For example, centers now have to pay a lot more attention to things like sanitization and cleaning. We have 386,000 kids in early childhood centers like this. They have new responsibilities that they did not have before the pandemic hit. Again, stable, affordable, high-quality child care is really important for workforce development. I think you'll recall, and I keep bringing this up, the Keystone Economic Development and Workforce Command Center. It's a public-private partnership that I established a little over a year and a half ago, I guess. They mentioned 5 things that stand in the way of creating new jobs in Pennsylvania. One of them is education, child care. The fact that we don't have enough keeps people from the workforce. It keeps people from doing the things we actually need them to do. We need them to to go to work, to attend training program, to go for job interviews. Can't do that if we don't have adequate child care. And it's also crucial to continue providing high-quality care during the critical early years. We all know early childhood education makes a big difference in the cognitive development of every human being on Earth. So we are doing what we can. My administration is already reviewing the preliminary results of a study that was done by Penn State on the operational and financial impacts that COVID-19 has had on early childhood education. And we'll use this data to see what else we need to do to encourage early childhood education. As we keep saying, early childhood education is like the Fram oil filter ad, pay me now or pay me later. We need to invest in early childhood education, or we're going to be condemned to spend a lot more money later on as a society. So this is something that's really a good investment for all of us to make. It's an especially good investment during a pandemic like the one we're going through right now. So thank you for having me here, and now I'm really pleased to turn this over to the Department of Health and Department of Human Services Secretary, Dr. Teresa Miller.
Good afternoon, and thank you, Governor, for the introduction, and thank you for your commitment to child care providers and really our early learning system. I think you get it. You understand the importance of childcare to getting our economy back on track, so we appreciate that. A robust, healthy childcare industry really is one of Pennsylvania's greatest assets. Childcare allows parents to go to work knowing that their children are growing and learning in a safe, caring environment that nurtures children, that cultivates healthy child development, and provides that introduction to education that really, as the governor said, benefits that child for their entire lifespan. As the mother of a 4-year-old, I get to see this up close and personal every single day. Simply put, childcare is a public good necessary for a functioning economy. Without access to reliable childcare, many parents, myself included, wouldn't be able to go to work. Since March, many of our childcare providers have operated under great risk to staff so that parents working in essential functions like healthcare, emergency preparedness and public safety, and food and retail operations could perform their life-saving and life-sustaining work knowing that their children were safe. The past 4 months have underscored both the necessity of childcare and how quickly challenging circumstances like this pandemic can completely change the way this critical public good operates. Changes must be made to keep staff and children safe, but as you can imagine, explaining these changes and safety measures to young children at a level that they can understand is challenging. We're all operating under an entirely new playbook, and childcare providers must make these changes knowing that parents are entrusting them with the care of their children. I wanted to take a moment, just as our other speakers have, to reach out and really thank every childcare professional in Pennsylvania for the incredible work that they do every single day. I said I get to witness this every day. I can't believe how difficult their jobs are and how important their function is. They've stepped up in a time of crisis to provide childcare for people who need it, and they continue to navigate a changing environment in a way that keeps our children as the top priority. This has been a difficult time for nearly every facet of our society, and the dedication that every childcare professional exhibits for their work and the service that they provide has been steadfast through it all. And for that, we will be forever grateful. We know that you are feeling strain on your businesses and making hard choices about how to reopen and sustain operations given enrollment changes, cost of safety measures, and ever-changing challenges. We will continue to stand by you through the evolving challenges ahead, and I'm glad we're able to make this additional $53 million available to help providers as we finalize the data from the study the governor mentioned that our Office of Child Development and Early Learning is doing in conjunction with Penn State Harrisburg's Institute of State and Regional Affairs. While we don't know how this pandemic will look in a week, in a month, or in a year, we do know that a healthy, robust child care system will be absolutely critical to weather the economic recovery ahead. This study will capture the experiences and challenges that child care providers have endured since COVID-19 arose in Pennsylvania, and will allow us to direct another $116 million how and where our child care providers need them most. This industry is vital to both a healthy economy and our children's futures, and we will not abandon our child care providers who dedicate their lives to our youngest Pennsylvanians, often at low pay and now at risk to their health. Thank you again for your dedication to caring for and educating our youngest Pennsylvanians. We will be with you through the challenges to come. And at this time, I have the privilege of introducing Tanya Bastinelli, Director of Bright Horizons here at PSECU. Put my mask back on.
Hello. Thank you for allowing me to share the experiences within our centers, including our very own center right here at PSECU. I'm Tanya Bastinelli, the Director of Operations here at the center. And within Bright Horizons, it's our priority continues to be health and safety of the children and staff at our centers during this pandemic. Our goal is to ensure that the health and safety practices are in line with recommendations that are provided by the CDC and requirements of our state and local municipalities, including the Department of Health and OCDEL, and we always have the health and well-being of the children, families, and staff at their core. Throughout the pandemic, we operated 150 of our 700 child care centers around the country to serve essential workers, and here in Pennsylvania specifically, we operated 12 of our 55 centers during this time. We've partnered with a pediatric infectious disease specialist, Dr. Kristen Moffitt of the Boston Children's Hospital, to implement enhanced safety protocols, including reducing our class sizes, restricting who came into the center, daily health screenings and temperature checks upon arrival for adults and children, masks for all of our teachers, our staff, and any other adults who enter our center, as well as strict guidelines on social distancing in the classrooms, cleaning, and disinfecting. Our protocols extend to having a designated staff person who escorts the children into the center every day and out, reducing the number of individuals that we're allowing in our center, including serving single snacks to the children versus our family-style snacks that we normally serve, as well as health screening questions for the entire household. In all of these centers, we've been putting these enhanced protocols into practice every day. These protocols allow us to maintain our health and safety standards and create a safer environment for our families, children, and staff during this very challenging time. We continue to consult with experts and monitor updated guidance to ensure that our protocols evolve with new learning around COVID-19 and so that children, families, and teachers are protected. Thank you for allowing me to share this important information, and at this time I'm going to bring Governor Wolf back up to answer questions.
Yes, Dennis.
Governor, there's a lot of numbers thrown out there. So in June, we gave $51 million, and in July, it'll be $53 million.
53.
And is that federal money or state money?
CARES Act from the federal.
CARES Act,
It's
federal money.
all federal, and then $116 million moving forward, and that's federal money. But we worked with the state legislature to make sure that was appropriated. So it was an Act 24. Teresa, you want to? Act 24 was state General Assembly, I guess, right?
Right.
But it was federal. 116, but it was still federal dollars.
And you mentioned 65 of these facilities have closed. Is that a total number across the state, or was that a specific?
That was as of the end of June, I guess. But as I also said, there were 100 that we sent out, I think the 51 million in June, who said they didn't really need it because they weren't planning to reopen. So 65 have absolutely formally closed. And I don't know how many more, or what that 100, how many of them are going to be coming back into business at some point.
And do you have a sense of how many total of those facilities there are across the state?
7,000. What did we say, 200 and some thousand children? 300 and some thousand. 385,000 children. Questions? Angela?
I have an off-topic question, if you're taking them.
Sure.
But
I was wondering if you will be extending the eviction moratorium. That deadline's
coming up pretty fast, and I was hoping you could weigh in
Coming
on
up
it.
on the 10th, I think.
I believe so.
Yeah. So I haven't made a decision on that yet.
What's preventing you from making that decision? What is there?
I
what's
just haven't.
standing in the way?
It just hasn't come to the end of this, so I haven't made the decision yet. Nothing's standing in the way of making it.
Okay. I mean, are you leaning towards it, given the
I'm not ready.
circumstances that we're in?
Not ready to say. Anything else? Yeah.
Yeah. Is there a number, so unrelated, we just had the 4th of July holiday. Did you get a sense of how things were in Pennsylvania? Are you concerned that within the next 14 days there'll be increased cases if people need properly masked and social distance?
Yeah, I am concerned. We have seen breakouts in certain areas. Allegheny County is the big area of concern at this point. There have been others more modest in the past. But right now, Allegheny County is the area, and we're working closely with them. That they're doing some things. But keep in mind, so overall, what that has meant is Pennsylvania has shown as a state an increase in number of cases. But keep in mind, that's from a pretty low base. We were and have been fairly successful. I think states are talking 10,000 new cases a day. We're now at 500 over the weekend, new cases. That's up because we were down between 300 and 400 before, so that is up, and that's a concern. It's up in localized places, and I think what we're doing is focused on those areas and the specific things that seem to cause them in those areas. So I remain concerned, but I think this is a good dry run for what may be a broader upsurge in the fall. And this gives us a chance to test things that we're doing. Again, as I keep saying, you were here last time when I said last week, we're in a very different place now than we were when this pandemic started. Our testing now is up to close to 20,000 a day capacity. We have contact tracers. We continue to increase both the capacity, but we're in a very different situation when we had very few contact tracers in the early pandemic. We could maybe do a couple hundred tests a day. And those are the things that are going to, I think, really allow us to navigate our way through this pandemic as we get into the future months.
I understand the concern is percent positive on the cases. Some states this weekend is in the 20s, percent positive. Do you know what that number is? Is that something you even focus on?
I don't know what the number is, but up until last week it was. Do you know what that is?
We've been below 10 for the most part, but I can get you some.
But I also think it hasn't really risen, which is the thing we keep looking at. So we have increased the number of tests, but the percentage positive outside of the outbreak in Allegheny County has been pretty stable.
This weekend there were fires in York and Lancaster, absolutely linked to fireworks. One in Dauphin County that may have been linked to fireworks. There was a guy last week that was killed in the Scranton area. There is some call for tougher regulations, and there are a lot of residents complaining about some of these commercial-grade fireworks that you can now buy in stores. And there's some push to maybe change the law. Do you have you heard those complaints, and is it something you would consider?
I mean, I'll consider anything. I think the complaints are there every time there are fireworks that go off, and I think one of the things we've got to figure out is what is the appropriate place to regulate those, local level, the county level, the state level, the federal level. I think I should always be open to a conversation, but again, I think this is something that is probably best done at the local levels.
And my last question, just over a week ago, Josh Shapiro talked about the relationship between DEP, your DEP, and the fracking industry as being, quote unquote, too cozy, and he called for some legislative things to change that. What is your reaction to that?
This is a democracy, and I welcome any group looking at us, the General Assembly, the press, the Auditor General, and the Attorney General, looking at how we do things and how we might do things better. So I think it's absolutely appropriate that we take a look at how we do things. I think a lot of areas where I disagree with the findings of the grand jury, but I think we need to take a look at every piece of constructive criticism and say, yeah, see if we can do a better job.
I remember that first commercial you did, 5.5 years ago, in which you talked about wanting to tax the drillers.
Yeah.
Do you get a little bemused at somebody saying you're too cozy with the drilling industry?
I didn't. Well, maybe I should have. I didn't take that it was aimed at me. I think if there are people doing a job that gets too close to any industry when they're and risk regulatory capture, that's a problem. And I think we ought to be open to anybody who looks at that and says, hey, you might have a problem here. Yeah, I don't have a problem with that, and I'm pretty clear that I don't. But I think we need to always be open to outside perspectives. Yeah, Angela.
Governor, last week you said that you would prefer counties make the decision as to whether to, roll back or go back to certain closures rather than have it done from the state level. I'm wondering if that is still the case in your mind, that counties should be making those decisions, and if yes, what are you advising them as to when they should be rolling back certain openings?
Yeah, I didn't mean to make it sound like I was passing the buck to the counties. What I was saying is that the state can do things with a broad brush, like a requirement for wearing masks, which I think is something that whether you're in Allegheny County or York County, it makes sense. It just reduces the risk. It's like stopping at a stop sign. And I think to the extent that there's an outbreak that has a local cause and is not affecting Tioga County or York County, then it ought to be dealt with at the level that makes the most sense. I think the future moving forward, before we get a vaccine or before we get a cure, the things that we ought to be looking at are things like contact tracing and testing. And right now the state is working with companies working in the state to see if we can come up with a better, easier test. I think the state is doing what it can to keep increasing the number of people who are going to be contact tracers trained to do contact tracing, so that when we see an outbreak somewhere, those things I think ought to be done at the state level. But if there's something specifically that pops up at the local level and says, maybe we can do something here, I think that's entirely appropriate.
But you're not ruling out at the state level ordering a county to go backwards, say into the yellow or even the red, if you see, particularly if that county doesn't have like a health department that can do that kind of.
Yeah. Well, first of all, most counties don't have health departments. So by default, the state is the health department for the county. As I keep saying, we're doing everything at the state level to avoid ever going back to these blunt instruments like, everything is closed or nothing's closed. And I think as we move into this, the more focused we can be, the more surgical our interventions, the better. Again, I think there are things the state can and ought to be doing, like increasing the capacity for contact tracing. Whether there's a health department or not, I think the state has a role to play there. In getting people to develop tests that can be administered easily, and we have more of them, and that the results can be communicated faster. Those are all things the state can do better than I think the local folks. As to how we partner, that's something that we need to keep working on. I think I need to keep working with county commissioners to make sure that we're in constant communication, and they need to be telling me what they think we ought to be doing. But a lot of what can be done right now is each county making sure, whether they have a health department or not, that they have the capacity to deal with whatever situation arises, however it arises, and whatever the cause. That would be, I think, something that now that we know more at the state and the county level, the counties are in a better position than they were 3 months ago.
But there's no specific metric at this point. You reach this metric, we want you to roll back some of it.
We don't have one, but I mean, so far, the counties themselves have been driving this, saying we're concerned about something. And usually it has to do with an increase and an increase that starts to get them concerned that there's something specifically happening here. Again, statewide, Pennsylvania is in pretty good shape. We have seen an increase, but it's on a low base, so I think so far we are in pretty good shape, but that does not mean that we can rest. We're not going to get complacent.
And at this point in time, understanding that it's only early July, any impediment to reopening schools for in-person instruction, even in certain counties?
Not the way we want to do it. The impediment is really going to be what do the individual parents and students see when we get to the point of opening? Do they feel comfortable going back to school as students? Do the parents feel comfortable allowing their children to go to school? Those are the things that I think we're all sensitive to, and we're trying to do everything we can to say, you ought to have the confidence to go back, that your school is doing this and this and this, and the way they're organized. I mean, the way folks here are being really sensitive to the needs and trying to build confidence with the parents of the children that they serve here. That's ultimately what it's going to take. It's not going to be any regulation. It's not going to be snapping your finger or waving a magic wand. It's going to be, do I, as a parent, have confidence that I can come here and pick my kids up, that I can drop them off here, and that they're going to be healthy? Yeah.
Do you see us wearing face masks until there's a vaccine, or do we have to get the numbers down to a certain level?
Yeah, I'm sort of thinking this is until we get a vaccine, but I don't have any real formal goal there. There's some places where people just wear masks as a matter of just people wear them, and I'm not sure that's not a bad idea. I mean, did I say that right? It's not a good idea. It's a good idea. I think it might be a good idea. Yeah, I mean, that's because this is something that actually does make you safer, and when I'm wearing a mask, makes me safer when you're wearing a mask. And if we're actually, we can't practice social distancing, that's a really important thing. Models out there suggest that states, areas where people wear masks, the infection rate is actually lower. So this is something that as we get into infectious disease era, and who knows when this is going to end, we probably ought to be thinking about this just to keep each other safe.
Thank you. Of course, yeah.
Anything else? All right, well, thank you very much, and get out of the sun.